Stroke is very common. According to the World Stroke Organization, 1 in 4 adults will have a stroke in their lifetime. There are over 13 million new strokes every year globally. Fortunately, the majority of people will survive. However, many people will remain with some sort of disability. Rehabilitation post-stroke is very important, and it involves a team of doctors like me, physiatrists, and a team of physiotherapists, occupational therapists, speech and language pathologists, psychologists, and social workers. One of the common consequences of stroke that I see in my pain clinic is shoulder pain. Today, I will demonstrate 24 exercises that people who had a stroke can do at home to improve muscle weakness, stiffness, and shoulder pain. So, let's talk about stroke shoulder today. First, let me talk to you about the 10 principles of exercises for stroke. Number 1, movement is the best thing to boost your recovery, your confidence, and your well-being. There is no medication, device, surgery, or cure for stroke. Exercise is still the best modality that we have to help the brain to recover from a stroke. Number 2, moving also reduces your risk of having another stroke. It reduces the clogging up of your arteries, it lowers your blood pressure, it stabilizes the blood sugars, reduces cholesterol, and if you make changes in your diet, exercise will also help you to reduce your weight. Number 3, you must practice some sort of exercise every day, 7 days a week, for at least 1 hour every day to see some benefits for a stroke. There is a window of opportunity within 2 years after the stroke that your brain is reorganizing and making new connections. We call this neuroplasticity. It doesn't mean that you cannot do exercises after 2 years. You can and you should, but the improvements after 2 years will be slower and it will take longer for you to notice the benefits. But don't give up. There can be brain reorganization after 2 years. Number 4, for each exercise, you need to do a mental practice before you start the exercise. Remember, you're not just exercising the arm or the hand or the elbow. You're making neuronal connections in your brain. Mental exercises, mental practices involves rehearsing the task mentally in your head. Do a mental visualization of all the movements you would do for the next exercise. And after you have seen them in your mind, then you start doing the exercise. Number 5, keep an eye on the movements that you are doing. When you are doing these movements, keep looking at your affected hand. The images of your arm moving will help the brain to make those connections. Your brain will receive information from your eyes, your joints, and your muscles. All this will tell the brain to make a new connection, a new synapses. Number 6, bilateral arm training. The same activity is done with both arms simultaneously. This is important for 2 reasons. First, the good arm will be your physical therapist. And the second thing is that the left brain communicates with the right brain. So if the good arm is moving, there will be a message in your brain going from side to side, telling the affected side to move. It's almost like a mirror therapy. The affected side of the brain will see how the healthy side of the brain is working, and it will imitate what is happening on the other side. Number 7. Task-specific training is better than just repetitive activity. So if you can find some activity that is meaningful to you and you can do regularly, that is better than just repeating these movements without a task in mind. I'll give some examples when I show you the exercises. Number 8, start slow and go slow. Don't try to achieve too much when you are starting. The most important thing is that each day you can do a little bit more than the day before. So I recommend you to keep a notebook and take notes of your progress. How many repetitions you can do today for exercise number 1, for example. And then Maybe you take notes, 4 repetitions today. Maybe then your goal for tomorrow is to do 5 repetitions of that exercise and then start increasing gradually. Number 9, about 80% of individuals with paralysis of the arm will experience some shoulder pain. Pain can be caused by a subluxation, rigid muscles, frozen shoulder, immobility, or repeated trauma. Exercises help to reduce pain in the affected arm. Shoulder pain is usually caused by a weakness in the muscles around the shoulder, and sometimes the muscles get rigid. We call this spasticity, and it's hard to move. Keep in mind that these exercises should not cause pain. If you do any of these exercises and your shoulder hurts, it's a sign from your body that you are overdoing it. And number 10, talk to your physical therapist or your occupational therapist or your rehabilitation physician. They can give you some specific advices for your case. Each person is different and it depends on the type of stroke and how much your arm is affected. I'll show you some exercise to improve range of motion, to strengthen the muscles, to stretch the muscles, and to relax. But this video is only for educational purposes. It's not intended to give you individual advice. If you need advice, please talk to your doctor. And if there is any emergency, please go to the nearest emergency department. Here is a list of what you need to do these exercises. A chair, a table or a desk, a cane or some sort of a long stick, a piece of fabric if you don't have a good grip to hold the cane, a towel, a hard pillow, an elastic band, a carpet or a mat to lie on the ground. If you go to the description of this video below, you will find a summary of these positions and exercises that you can download and print to do at home. Just find the button down that says Show More. I have also included timestamps on this video, so you can scroll up and down and find the exercises you are looking for in the timeline. This is a range of motion exercise, and one hand is going to help the other hand. So with the unaffected hand, you're going to grab the other hand and you're going to do movements, the good hand helping the affected hand. Try to keep your elbows straight. If you can come just to the level of your nose, that's okay. And keep going down and up to here. However, if you can go above your head without causing any pain, any discomfort, keep going. The farther you go back is better, without causing any pain or discomfort in your affected shoulder. Ideally, you should be able to go all the way up behind your head and come back. The important thing is that your affected arm will start working with the good arm. It's not just the good arm doing the movement and grabbing your other arm, but both working together. See if there is any movement and try to look at your hinge. So look at your hinge when it's passing in front of your face. Keep looking at it. Remember, you are training your brain to make new connections. And you may do many repetitions of this exercise until you start getting fatigued. So if this is about 4 repetitions, that's all you can do, that's fine. The important thing is that then tomorrow you may try to increase to 5, and then 6 and 7. Ideally, you should be doing all this range of motion about 20 times. And you need to repeat this every day, 7 days a week. So this exercise is very similar to the previous one, but we are going to do in the diagonal. And so you're going to grab the same thing, both of your hands together, and you're going to go from the right hip to the left side of your head, so diagonally. This is very important, both elbows straight and you're doing this diagonally. Your head should be relaxed on the ground, and when your hand passes in front of your face, make sure that you look at your hand, you are seeing it and feeling it, elbows straight, and you do this as many as you can until you get fatigued, ideally 20, and then you do for the other side. So grab your hands together here, elbows straight, and now you're going to do to the other side and look at the hand when it passes in front of your face, and go all the way, stretching and doing range of motion of the shoulder. So one hand is helping the other one. The good hand is being the physiotherapist for the bad hand, for the bad shoulder. So keep doing this movement. So there is a modified version of this exercise if you have an elastic band like this, and if your affected hand can grab the elastic band, then you can use this. So both hands here together, and what you're going to do is you're going to keep one hand close to the hip and the other one will go in the diagonal and all the way down and come here to the diagonal, all the way touching the floor there, and do for the other side as well. So this one keeps here on the side of your hip, and this one goes all the way and touch the floor here. So this is straight elbow. This is strengthening the muscles, but also it's range of motion for the shoulder. We are opening the shoulder, opening the axilla, which is very important because people who have stroke, they usually have the muscles pulling the shoulder towards the trunk. So it's important to open the arm like this. If you do have a cane, then you can do some exercises for the shoulder using the cane. So if you have a good grip of the hand here, you're going to hold, let's say that this is the affected hand, and with this one you're going to hold here. And what you're going to do is, with the good arm, it's going to help the affected arm to move all the way up. And again, if this causes pain, you should not be doing it. And you can do from here. And some people can only come to the level of the nose and come back here and come back. And again, do this as many repetitions until your muscles get fatigued. And in the beginning, it's going to be a few repetitions. You will not be able to do too many, but as you practice this every day, you're going to get stronger, and then each day you can increase the repetitions until you can do 20 of those. So this exercise is similar to the previous one, but now we are going to do side to side. And what happens is, when the person doesn't have a good grip on the affected hand, you can use a piece of fabric to attach the hand. This is a scarf that I have, and you can just go around and hold the hand here to help the hand not to escape here from the grip. Okay, so the exercise is similar to the one we did before, but now we're going to go side to side. So you see the good hand is now pulling the affected hand and pushing the affected hand here. So go all the way to the floor, up, look at your hand when it's moving. Your eyes should be following your hand, and you do this movement using the right arm to guide your affected arm. And again, do as many repetitions as you can, And you can use, I think this is better, you can use like 4 or 5 and then start increasing every day. Don't forget, the elbow has to be straight and your eyes should be following your affected hand. So this exercise is for the elbow flexion and extension. It's important that you grab a towel and you put under your elbow here. And the other important thing is that your shoulder, elbow, and hand is aligned. So don't bring your hand towards your belly, because this is a movement that people with stroke, usually they keep their hand, the shoulder closed like this, and the hand on the belly. We need to do the opposite. We need to open the arm. So for this exercise, so you put the towel under the arm here, and then you're going to bend and straight the elbow. And do this as many repetitions you can, ideally doing 20 every day in the affected side. So this is an exercise for weight bearing on the shoulder. Very important, because weight bearing on the shoulder will help to strengthen the muscles of stabilization of the shoulder. So we have a hard pillow under our chest, and then we're going to, it's important to align the elbow with the shoulder here. And we're going to do, the first stage is very basic, just doing like a cat-cow, just raising the chest up and down. You're putting weight on both shoulders, right and left. Just go down and up, down, up. Okay, and then you can progress when this becomes easy, and you can do 20 repetitions of this very easily. You progress, and the next stage will be, you're going to go side to side. So you're going to put more weight on the left and more weight on the right, more weight on the left, more weight on the right, and do this 20 times on each side. And you can rest if you get tired and go back. So you feel the weight of your chest going through the left shoulder, left elbow. And when this becomes easy, that you're going side to side, you will start lifting the unaffected arm and putting more weight on the affected side. So you do this and come back. So you see I'm lifting the good arm of the floor here and putting almost all of the weight of my chest on the affected side. And then you do this 20 repetitions. And when this becomes easy to you, you will going to start lifting completely the good arm and putting all of the weight of your chest is going through the affected arm. And then you rest. Then you lift and rest. And lift and rest. And do this 20 times. And don't forget, the last exercise when you're lying down should be the stretching and relaxing exercise. So the important thing to stretch the shoulder is opening the axilla. So what we are going to do is we're going to start going up, opening the axilla, and find a position that is comfortable for you. If you can, hold your hands here above your head and stay in this position for a couple of minutes. And the important thing here is to relax. Try to relax, especially these muscles here, the pecs, the pectoralis, all the muscles of the axilla, because when the person has a stroke, they have a tendency, there is rigidity pulling the arm to this position. So we need to do the opposite. We need to open and stay here for a couple of minutes, relaxing and stretching these muscles. So now these exercises, you need a chair, and these are very simple exercises. Again, the good hand is going to help the affected hand. So grab them together, interlacing your fingers in your hand, and elbows straight, touch one knee, and you're going to raise your arms, looking at your hand all the way up to about the level of your head, the level of your nose, and come down. So go up. You don't need to go too high. If you want to go too higher, you can. But don't forget your eyes always following the hinge. Okay, that's very important, because your eyes are sending information to the brain that the affected hinge is moving. And do this 20 repetitions, because there is one thing called neglect. When a person has a stroke, the brain kind of forgets that that part of the body exists. So you need to tell the brain, yes, look at my hand, it's moving. And so the brain will wake up and make connections. And you can do also on the other side, so relax. It's important to relax your shoulders and go on the opposite side. Okay, so do for both sides. So now I'm going from the right knee to the left side of my head, and you see all the way I'm looking at my hands. It's really important that you look at your hands. Okay. While you are in this position, you can also do some exercise for your elbows, relaxing your shoulders. So now we are going, grab both hands, hold both hands, interlacing the fingers, and you're going now to bend the elbows. Bring the hands close to your chest and down, close to your chest and down. So the good hand is helping the affected hand. And look at the affected hand and tell your brain, you see it's moving, so it can move. There is ability to move. Wake up, you're going to recover. You're going to create some synapses in your brain when you're doing these movements. You have to do them every day, 7 days a week. So now we're doing some exercises for stretching of the muscles around the shoulders. And again, we can use the cane. And if you don't have a good grasp of your hinge, just wrap a fabric around your hinge and the handle. So keep your elbows straight. And we're going to stretch the pectoralis and biceps. And do for the other side. So the pectoralis is this muscle here, and biceps is this one. So you should be feeling stretching of the muscles when you do this. And the good hinge is like a guide for the affected hinge. And you do this. So if this is the affected hinge, then I recommend you to do more on this side, but you can also do on the good side. In here. So you see opening the axilla. Some people have difficulty even to wash the axilla because it's so tight. The arm is so rigid and it's so close to the chest that the person has even difficulty to clean and to wash the axilla. So we are doing this. We are doing stretching of the biceps and biceps and pectoralis muscles. So the other stretching that is important is to stretch the trapezius muscles. Trapezius are these big muscles here, and they usually hurt. There is usually myofascial pain of the upper trapezius area that can radiate pain to the shoulders. So find an anchor on the side of the chair here, and you're going to pull slowly to the other side. Relax, and when you breathe out, so breathe out 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. You're pulling slowly, just slightly pulling. You don't need to pull too much. Take another deep breath. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And another deep breath. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. It's always good to do with the other side, but if this arm is weak, you won't be able to do this. So just do with the affected side. Another muscle that usually hurts around the shoulder is called levator scapula. It's a muscle around here in the shoulder blade. So you find an anchor here in the chair, and we're going to pull in the 45 degrees towards your opposite knee. So just put a good hinge at the back of your head and take a deep breath. And when you breathe out, you count loud to 10 and pull slightly down towards the other knee, okay? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Take another deep breath. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And another deep breath. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Come back slowly, so then you don't get dizzy. So now for this stretching, we need to stretch the pectoralis muscles here. You're going to sit on a chair, but the back is here, because you're going to grab your hands, both of your hands behind your body, and you're going to pull backwards. So you see I'm stretching the pectoralis muscles in front of my chest, and I'm pulling both of my hands backwards here. So pull, 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 and come back. And you can do this again. Pull. So you're opening your chest, stretching the pectoralis muscles. Hold, and come back, and relax. This is important because pectoralis muscles are usually very shortened and tight in people who have a stroke that affects the shoulder. And come back. So for this exercise, you need a desk or a table. Ideally, the height of the table should be at your elbow level, so then you're not shrugging your shoulders too much and you're comfortably sitting here. And the first exercise we're going to do here on this desk or table is the exercise to rotate the elbows. You're going to grab both hands together, interlacing the fingers. So the good hand is going to help the bad hand. So you're going to do this rotation movement. This is important for the elbows mainly. Okay. And do this 20 times for each side. If you get fatigued, you can stop and increase the repetitions the next day. And you should be doing this every day. So we cannot forget the wrist too, because the wrists can also get rigid. So when you are in this position here, you can also move the good hand, helping to move the bad one, the affected hand, and going in one direction and the other one. So the good hand should be helping the affected hand to open the fingers, because That's the position that usually the patient will hold. So then the good hand will open the fingers, interlacing them, and let's do the movement of the wrist. So both of the elbows are on the table here, and you're just moving the wrist from one side to the other one. And you can also do side to side or up and down. So this is up and down, this is side to side, and make sure that the good hand is always helping the fingers to open, because the tendency is to close and be like this. So for this exercise, you're going to imagine that there is an imaginary object that you need to grasp. So you're going to stretch, stretch, stretch with your fingers open and bring the object to you. So this is the stretching of the arm. Open, 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 and close. You can do with both hands, so the good hand can imitate each other. So if you want, you can do with both, and always looking at the affected hand. You need to train your brain that your affected hand can move. So arm goes in front, stretch, stretch, and reach far. Open the fingers, and when you're bringing the imaginary object, you close your hand. Do this many repetitions as you can. If you get fatigued, you stop, and then you take notes how many you could do today, and your goal is tomorrow to repeat, do more repetitions that you could do today, up to the level that you can do 20 of this every day. So now for this exercise, you're going to put your elbow on the table, and you're going to go all the way this side of the table and open. Ideally with your elbow straight. If you can maintain your elbow straight, that's ideal. And the other hand is on your side. Keep your eyes on your affected hand. So your brain is learning that this arm is able to move, right? If you can't hold this because it's too tiring for you to keep the elbow straight, you can just do this. So you're opening and closing here. So this exercise now is similar to the previous one that we did, but now we are going to do with both hands together, elbows straight. So it's important that you interlace the fingers, so the hand will be opening here, elbows straight, and we are going to move the trunk. So you see I'm now moving my whole body to one side and now to the other side. The previous exercise was just moving the shoulder. Now I'm moving my whole body, and I'm looking at my hands and on the other side. So do this as many repetitions as you can until you get fatigued, and ideally 20 on each side, okay? So now another movement that we need to do from the shoulder is to help the shoulder to rotate. One of the important movements that a person with stroke loses when they have a stroke is the ability to do external rotation. And although they can do this, if this is one of the exercises they could be doing, elbows close to the chest and opening up, it's hard because sometimes it hurts. So the easiest way of doing this is the good hand will help the affected side. So put your elbows on the table, relax the arm, ideally with the elbows straight, but if not possible, this is okay. So the good hand will rotate the shoulder out and inside. You see my hand moving? I'm not doing anything with my hand. This is doing all the movements. So there I grab my arm here, and it goes inside and out. So this is moving the humerus, the ball inside of the socket, inside and outside. This is excellent to prevent frozen shoulder. So out and inside, outside and inside. Okay, do this 20 times for your affected arm. Okay. So now the last two exercises here in the chair and desk is stretching exercise. So we're going to stretch our rhomboids, the muscles on the back of your thoracic spine. And to do this, both hands together, interlacing the fingers, always looking at your hand, and we're going to go forward, forward, and so you have to feel stretching on the back of your shoulder and stretch. And when you are there, just stay there, relax, and come back. And again, you can do this as many repetitions as you can. Go in front. You're stretching all the muscles on the back of your shoulders. And when you get here, make sure you relax and look at your hand. You are relaxed. And come back. Do this many repetitions. So the last exercise is stretching of the latissimus of the dorsal here. And to do this, I recommend that you get your cane and you hold both hands here. If you can't have a good grasp, just wrap a fabric around your hand. So you hold both here. And with the desk in front of you, you're going to put your elbows on the desk here. And you're going to lower your head. And you have to feel your latissimus stretching and opening there. You can even rest your head on the table and try to pull the cane behind your head, and you're stretching all the muscles here, the latissimus, the triceps. I hope you enjoyed these exercises for the stroke shoulder. If you continue having shoulder pain after stroke, talk to your doctor. You may need other treatments like medications or other modalities. I have another video that I talk about neuropathic pain and the type of medications that we use to treat post-stroke pain. It's also important that you treat any anxiety, depression, or mood disorder associated with stroke. See this other video where I talk about mind-body therapies for pain. Remember that the treatment of chronic pain is better when you use multiple tools. I like to remember my patients that they need a toolbox to self-manage their pain. The type of tools include movement, modalities, manual therapy, mind-body therapies, and medications. These are the 5 M's of self-management toolbox. Well, it is better not to have a stroke than to treat it. We all know that an ounce of prevention is worth a pound of cure. How can we prevent a stroke? High blood pressure continues to be the strongest factor leading to stroke. Make sure you treat and monitor your blood pressure. Obesity, diabetes, high cholesterol, smoking, and low physical activity are all important factors leading to stroke. And these are things that can be modified. I have another video that I talk about strategies to quit smoking. Press the share button below to send this video to anyone with stroke and shoulder pain. And in the comments below, please write down if you had a stroke and if you're doing exercises and what's working for you. Also, there is a link to any products that I mentioned in this video if you want to purchase them. If you like this video, give a thumbs up here, turn on the notifications, and don't forget to subscribe to this channel. You can also find me on Twitter, Facebook, and Instagram. Thank you for watching. Bye!